If you're dealing with osteoarthritis pain and you feel like you've tried everything, you are definitely not alone. But what if I told you there's an approach that's been around for over a century that might offer some real hope? Today, we're taking a closer look at something called low-dose radiation therapy. I mean, does it feel like that chronic ache, that stiffness, is just running the show? It can totally take over, dictating what you can and can't do each day. And that is just plain exhausting. You've probably done all the right things, right? The physical therapy, the anti-inflammatory meds, maybe even painful injections. But when that relief just doesn't come or doesn't last, it's so easy to feel completely stuck. But there might be another way forward. And that path is called low-dose radiation therapy, or LDRT for short. And what's wild is that it's not some brand new futuristic tech. It's actually been used successfully for over 100 years to help with inflammatory conditions. So what is LDRT exactly? Well, think of it as a non-surgical treatment that uses incredibly small, very precise doses of radiation aimed right at an inflamed joint. The goal is simple: reduce inflammation and, with it, the pain. Okay, let's just get this out of the way. When you hear the word radiation, you probably think of cancer treatment, and that's a completely different ballgame. With cancer therapy, the dose is high because the goal is to destroy cells. But with LDRT, the dose is so much lower. We're not trying to destroy anything. The goal here is just to calm things down and reduce inflammation. So how in the world does such a tiny dose of radiation actually knock out pain? Well, it's all about going after the root of the problem, that nagging inflammation that's causing all the trouble in your joints. It's kind of like sending in a specialized team to restore order. First, it tells the overactive immune cells in the joint to just take a breath and calm down. Then, it dials back the activity of the specific cells that are sending those chronic pain signals. And on top of that, it can even help reduce the buildup of stiff scar tissue, which is a big reason for that feeling of stiffness. It's a really smart, multi-level approach. All right, this all sounds pretty promising, but it's really important to know that it's not for everyone. So let's get to the big question. Who is actually a good candidate for this? Let's dig in and see if this might be a path worth exploring for your situation. Generally, doctors consider LDRT for a pretty specific group. We're talking about people who have moderate to severe osteoarthritis and, crucially, haven't gotten the relief they need from all the standard stuff. It's also a fantastic option for folks who either can't have surgery or simply want to avoid it if they can. And it's most commonly used on what are called peripheral joints, basically the major joints that aren't part of your spine. So think of all the usual suspects: knees, hips, shoulders, and even the smaller joints in your hands and feet. Now, here's a really important heads up. Because the spine is so complex with the spinal cord and all those nerves, LDRT is typically not used for osteoarthritis there. So let's imagine you are a good candidate. What's it actually like to go through this treatment? What should you expect? Well, the best part is how incredibly simple and straightforward the whole thing is. It's an outpatient procedure, so you go in and you go home the same day. Usually it's about 5 or 6 sessions spread out over a week or two. And each session, it only takes a few minutes. Best of all, it's painless and there's no need for any anesthesia. So what's the payoff? The potential benefits are huge. We're talking about a major reduction in pain, which naturally leads to better mobility and just being able to move more freely again. And of course, it's completely non-invasive. No cuts, no surgery, and it's considered a very low-risk procedure. But here's the real game changer. How long does the relief last? For many people, this isn't some temporary band-aid. The pain relief can last for months, and in some cases, for years. That can absolutely change your life. Okay, but with any medical treatment, you have to have an honest conversation about the whole picture. So let's weigh the benefits against any potential risks. On the one hand, the benefits are pretty clear: serious, long-lasting pain relief and just getting your quality of life back. On the other side, what are the things to consider? Well, they're pretty minimal. In rare cases, some people might get a little bit of mild skin irritation, and there's a theoretical, and I mean extremely small, risk of cancer that you should absolutely talk to your doctor about. And, of course, it's not for pregnant women or for children. And, this quote really puts that risk into perspective. For the typical patient, who is often an older adult, the real, tangible benefit of being able to move without pain and enjoy life again is seen as far, far more significant than that tiny theoretical risk. So after looking at all this, how it works, who it's for, and the pros and cons, it really comes down to one final question. Could this be the right next move for you and your health journey? Ultimately, the goal here was just to give you the information so you can be empowered. The only person who can really help you answer that question for sure is your doctor. They know your history, they can look at your specific case, and help you decide if LDRT is a good option to finally get a handle on your pain. Thanks so much for joining me.